Hello, all. My name is Tashelle Carpenter. My topic is issues with death and dying in late adulthood, human behaviors in a social environment 501. Here's an overview of my presentation. I will start off with the introduction, discuss developmental changes in late adulthood, Erickson's theory of psychosocial development in late adulthood, the impact of death and dying in late adulthood, the need for more social supports and resources, social work practice, and last but not least, my reference page. Late adulthood is considered to be a person aged 65 and older. During this stage of life, the aging process begins to affect many developmental milestones, such as activities of daily living, physical, cognitive, and psychological changes. The level of functioning tends to decrease and diminish, which is common in older adulthood. However, when issues with death and dying are factored into these changes, this can affect older adults' development. I will examine issues with death and dying and the link with interpersonal and social development, the need for more social supports to address death and dying, and the importance of social support networks as it relates to enhancing older adults' development and longer life outcomes. My next few slides will focus on psychological, cognitive, and physical developmental changes in late adulthood. Physical changes. During this developmental stage, older adults begin to experience issues with a decline in bone and muscle mass. Particularly in older adults, issues with osteoporosis and arthritis occur. Both are associated with old age and can limit daily activity. Both hearing and vision related problems tend to decline during this phase as well. Older adults are experiencing issues with hearing that results into the need for hearing aids. Older adults are experiencing issues with vision as well, which relies on glasses. Physical appearances start to change, such as the onset of wrinkles, skin sagging, which becomes more visible. Aging spots such as discoloration are becoming more visible. Gray hair, and in older adulthood, their teeth begin to deteriorate, which result in older adults relying on false teeth. The decline in central nervous systems functioning, affecting reaction time and coordination, such as being able to go to the bathroom. Cognitive changes. Some cognitive changes are memory loss. Two in particular, which are very common, is dementia and Alzheimer's. Dementia is normal in older adulthood, which is more so a mental disorder that affects the brain, whereas Alzheimer's is a disease which affects the memory process, such as short-term memory. Another cognitive change is loneliness. This tends to happen when the death of loved ones occur. Family begin to separate or fall apart, and limited social interactions. Psychological changes such as depression and suicide. Older adults tend to suffer with depression more as they cope with different changes in life, such as the death of a loved one, illness, physical health, retirement, and financial gains or losses. Suicide is one of the leading causes of death among elderly people. Elderly people are viewed to be likely to commit suicide versus young adults. Suicide tends to increase as older adults increase in age. My next few slides will focus on Erickson's theory of psychosocial development, stage 8, integrity versus despair in late adulthood. In most cases and circumstances, a person's reaction to death, dying, loss, and grief of a loved one is different depending on multiple factors. However, in older adulthood, the impact can be a lot strenuous and life changing. with multiple changes occurring both physically and mentally, including family dynamics and supports. One could begin to develop a sense of doubt and despair. Stage 8 of Erickson's psychosocial development, integrity versus despair, states people in older age reflect on their lives and take inventory of their success. People who are satisfied with what they have accomplished have a sense of well-being and peace. Those who are not satisfied have a sense of despair, and they mourn for the loss of opportunities. Rogers, 2013. For example, an older adult may reflect back on their life accomplishments and obstacles as being the platform of who they are, especially when they're able to successfully address any life crisis and obstacles, versus an older adult dealing with despair. And a sense of despair, reflecting upon life experiences and failures, one may fear death, a sense of life is too short, and depression. Older adults tend to question their purpose with continuing their life wondering, what was the point of life? Was it worth it? These are examples of negative perceptions that manifest from life crises that have not been successfully resolved and addressed in late adulthood. Integrity versus despair. During the stage of integrity and despair, older adults tend to exhibit strengths and feelings such as resiliency, empowerment, and self-efficacy and integrity, versus stress, vulnerability, and fear in someone who is experiencing despair. Older adults that exhibit integrity can successfully approach their goals, complete tasks, and challenges successfully through their own control, motivation, behavior, and social environment, versus an older adult that exhibits despair, experiencing various changes that they feel is out of their control or cannot control, begin to doubt their reason for living. According to the journal article on self-efficacy behaviors for reducing stress in older adulthood by Schellner and Vansberger, self-efficacy is particularly important resiliency resource for older adults. Diaz, 1996, found that self-efficacy is an internal resource that withstands the stressors of the role and life transitions of old age. The purpose of this study explored self-efficacy as an internal resiliency resource that vulnerable older adults experiencing stress due to various dynamics, one in particular social network limitations. Self-efficacy promotes older adult psychological health also by interacting with and strengthening environmental resources. The study generated narratives which presented descriptions of actual coping behaviors that older adults use to overcome stressors and which demonstrated self-efficacy in action. In regards to death and dying, one interviewee, age 73, described his response to his wife's death and how it changed his life, which caused him the most stress. Losing Virginia was the greatest stress ever I went through. You do reach a place where you manage your feelings. You learn something of living by yourself. But always you have this sense that half of you are gone. You are always lonely. Now, these next few slides will focus on the impact of death and dying, followed by a slideshow presentation through YouTube. Bereaved Elders, Transformative Learning in Late Life by Paul J. Moon. Schaefer and Moose, 2001, assert that among the array of life crises, the death of someone we love is one of the most emotionally wrenching. Moon, 2011. Bereaved elders are associated with excessive suicide ideation and death wishes. Barney and Ralph, 1999, likely causing them to be at a heightened risk for suicide relative to younger groups. Moon, 2011. This particular study provided more knowledge and understanding of older adults' transformative learning theory, which is the process of development that recognizes how changes can occur in a person as a result of crisis like promptings or disorienting dilemmas, particularly difficult, tragic, or painful experiences such as the death of a loved one. The next few examples will focus on four different people and their perceptions of a loved one that they have experienced in late adulthood. This particular study was designed to better understand older adults' transformative learning through bereavement in late life. There were three questions that guided this investigation. What do older adults specifically what do older adults specify as being transformed within them as a consequence of late life bereavement? How does transformative learning affect older adults' ongoing lives? And last, how do older adults describe the process of transformation? Gary focused on his sister's death, such as, for Gary, the poignancy of his own mortality was pitifully stated. It made me more aware of my own mortality, and I think when a sibling dies close in age, it makes you more aware of mortality. Heather, on the other hand, stated that during her husband's death, she was present. I felt like something had just been pulled out of me, like part of me died too. In fact, I looked at the clock and said, I don't know what I'm going to do. Eve, on the other hand, said that she felt a sense of loss. I mean, I was lost. The three main people died so close together. I didn't know whether if I could really go on with my life or not. Last but not least, Josephine. When my husband died, I had to do more on my own. But when my son died, I had my husband and my daughter. When my son died in the fall, we had terrible weather that winter, so we were home a lot. Anytime anybody wanted to talk, we knew the three of us to rest and cry and talk, and that's how we got through it. When my husband died, there wasn't anybody to talk to. Now let's think about Heather and Eve for a second. Take some time to reflect on Heather and Eve's comments. Both experienced significant losses with loved ones. Eve in particular experienced the loss of multiple people. What impact does this have on their aging process in late adulthood, considering what I discussed this far with integrity versus despair? Consider the possibility of lack of resolution and how might this manifest. Now that you had some time to think about this, let's move on to the next slide. Social factors may be a primary importance in older adulthood because the negative life events experienced induce loss of social connectedness, such as the loss of a spouse may limit the social support network. Bergman and Biscani, 1999. Stresses of this type are hypothesized to directly affect the risk of illness onset, duration, and outcome, and social factors have been identified as moderators of the relationship between stressor and illness that is referred to as the stress buffering effect of social support. Bergman and Biscani, 1999. During my research for related topics to utilize for my presentation, I noticed a common theme with loneliness among older adults as it relates to lack of supports and resources. There was also a common theme with older adulthood and the impact on social support networks and spirituality as it enhances one's social and interpersonal development. The next slide I will focus on is a man who lost his wife and how he utilized spirituality as a social support. After the video, we'll focus on supports that's needed to help older adults get through times of issues with death and dying who don't have spirituality to focus on as their main support. So as you can see in this particular video, the guy focused on God as spirituality and as a support to help him get through, the death and dying of his wife. However, others don't have that opportunity, or others don't seek God for support and guidance. So they have to rely on other social supports, which I will focus on in my next slide. The need for more social supports and resources to help with issues with death and dying in late adulthood. One support that there needs to be focused on is grief support for older adults. Although there is grief counselors out there to focus on a realm of issues with grief and loss, however, in particular, there needs to be something that focuses on specifically with older adults issues with death and dying. Another focus should be on more companion groups for older adults, such as support groups that have other adults that's dealing with some of the same things in regards to loved ones passing, and how do they cope with it. What does the process look like? What does the process look like when dealing with the death of a loved one? As well as focusing on another support group would be a life coach, one that helps prepare someone, or one that helps seek support, and then community churches. General social work practice. Things to consider and applying to practice when working with this population are to focus on the individual needs. Particularly with older adults, it's important to consider factors such as physical, cognitive, and emotional and environmental surroundings that impact their well-being, as well as their limitations. The ability to meet the client where they are, especially in a vulnerable time of death of a loved one. Assessments should be utilized to identify strengths, self-care strategies, and daily activities that encourage community engagement. Social workers should be able to ensure there are available resources in the person's community to actively engage in services. As a social worker, it's important to remember that older adults are on a fixed income, limited financial resources, limited physical mobility, and transportation resources, which a plan should be identified as well during an assessment phase. As the worker, it's our job to educate our elders. Thank you for taking this time out to listen to my presentation. Again, my name is Tichelle Carpenter, and I've discussed issues with death and dying in late adulthood. The next few slides are my reference page.